So every procedure has risks and benefits, and as a plastic surgeon who is trying to inform you of your surgery before you do it, it's my job, and any surgeon's job, to inform you of the risks and benefits of the procedure. Let's start with the good stuff. The benefits are, you look better. It's totally a cosmetic thing. In certain cases, there are non-cosmetic benefits, such as if you have a fold of skin or an irritated scar that gets super infected or gets rashes in the summer. That's an actual medical benefit that you're getting. If you have back pain because your stomach is hanging down, that's a medical benefit. Other benefits, aside from aesthetic, are you can change the type of clothing you wear. There are mental health benefits in changing your self-image, the way you interact with other people as well. But there are risks of the procedure. Every procedure has 3 risks: infection, bleeding, scarring, and tummy tucks are no exception. Infection in tummy tucks is quite rare, less than 1% in my practice. Bleeding, in 3,500 tummy tucks, I've had 2 that had some bleeding that needed to be addressed. Scarring, 100%. Every time you cut the skin, you make a scar, and it's my job to hide it in the right spot and to do everything I can to make it heal as nicely as possible. It's your job to inform me of any scarring irregularities you have in your family or in yourself, and that you follow the instructions. And if you come to your follow-ups and I see the scars a little red or a little brown or a little raised, there are things I can do in that moment to stop the process and improve it. If you wait and come back 2 years later and say, I don't like my scar, we're starting from ground zero, and it's much, much harder to correct. So it's both of our jobs to make sure that it heals well. Other common risks in tummy tuck surgery: seroma. And what's a seroma? When you're doing a tummy tuck, you're lifting the skin up from here to here. And so it's all lifted up, tightening the muscles, pulling it down, and you think of the healing as the line, but this whole surface has to stick down. And as the surface is sticking down, it's a process that creates fluid. And you have a small drainage tube at the time of a tummy tuck to remove that extra fluid, and we remove that tube when it's below a certain number. But in some cases, you can still keep accumulating fluid underneath the surface of your skin. That happens, I would say, in 3 to 5% of patients. It's very simple to extract the fluid without surgery with a small needle. The nice thing is your skin is numb in the bottom part, so you don't really feel it at all, and that might have to be done a few times if you are somebody who accumulates extra fluid. Let's talk about the biggest risks, the things to worry about the most, because it would be unfair of me not to inform you of them. The biggest risks in this type of a procedure are what they call VTEs, venous thromboembolus. And so what they are blood clots that can form in your legs. Blood clots form in your legs sometimes because the circulation is abnormal or there's an anatomic problem, or some people have a genetic predisposition to it. If you have had blood clots in the past, you have a higher risk of having blood clots, a family history of it, taking birth control pills. There are a couple of things. Even having COVID is a risk factor for having an enhanced ability to form clots in your legs. Before the surgeries themselves, we assess your risk for it. The average patient has a risk of about 1%, so it's not really high, but it's not 0. And I take steps to try to reduce this risk. What do? The day of surgery, you're going to get an injection of a blood thinner before surgery to make it harder for you to make the clots. We're going to put you in compression stockings that you take home and wear for the week to help you with your circulation. And we have a machine that massages your calves all through the surgery so that blood is always flowing. And when you go home, we make sure that you don't just lie there like a zombie. You do little ankle rolls like they tell you on long plane flights. And every 3 hours or so, you get up and walk for 30 seconds. That's what they tell you after pregnancy, because it's similar to the risk of blood clots in pregnancy. And so it's no more risky than a pregnancy blood clot. So if you've had pregnancies before, you have somewhat of an indicator, but they're not 100%. So those are the things we do to prevent them. How do you know if you have a blood clot? If you should notice that one leg is more swollen than the other, or you have pain behind one knee, not the other one, those are indications, or you can see a visible vein that wasn't there before. That's when you call me. We do an ultrasound and assess you. And if there's a blood clot, it's usually just taking some pills to dissolve it and figure out why you formed the clot. There's nothing that I do or any other surgeon does in the OR that causes the clot. We're not manipulating your legs. It's just a byproduct of being under anesthesia in an operating room. That's one of the reasons I like to try to do the procedures more quickly, because the less time under anesthesia, the less time that the blood isn't circulating. as well. The main peril of having a blood clot in your leg is all the veins in your body eventually drain back through the lungs to get oxygen. And so if you have a blood clot in your leg and you ignore it and don't do anything about it, eventually, usually within the first week or two, that clot can break loose and it will go into your lungs. And if you get blood in your lungs, much harder to breathe. And so this happens less than 1% of the time. So what do you watch out for? It's normal after surgery to feel tight, like you can't take a deep breath because I've just tightened your muscles. It's normal if it hurts in your belly if you cough because I've tightened the muscles. What's not normal is everything's okay and all of a sudden you're short of breath, you can't catch your breath. Or you start coughing and blood comes out, which I imagine would alarm you anyway. Or if it hurts in your lungs to breathe, and it sounds weird, but you're taking a breath and it hurts for the air to come in, do not call me, call 911 immediately and say, I had surgery recently, I'm having trouble breathing, or I'm coughing up blood, or it hurts in my lungs to breathe. My doctor thinks I might have a blood clot in my lungs. They will do a CAT scan. If there's a blood clot, they will give you medicines to dissolve it. While I can't prevent blood clots, nobody can, I can assess your risk for them and let you know what that would be. And I can educate you like I'm doing now so that if it happens, you know exactly what to do, you don't waste any time, and that keeps you as safe as possible. Those are the main risks that we watch out for. Obviously, there are others like temporary loss of sensation or skin sensation loss, healing issues, circulation to the belly button. There are a lot of small risk factors, but before your surgery, you will read through an entire packet that lists every single known and common complication, and you'll discuss it with your surgeon beforehand if there are any questions. In my practice, I have you fill it out, the nurse goes over things with you, and anything you put a little check mark next to you're unsure of, we go over 100%, because it's okay to be nervous before a surgery because you're an intelligent person, you realize that it's a surgery and you're not getting ice cream. If it's not normal to feel like you don't have confidence in the surgery or something is going to go wrong. So it's my job to inform you of the risks. It's okay if you're nervous, but you also should have the confidence that you're in the right place and everything's going to go well.